All right, today we are diving into the latest guidelines from the American Diabetes Association to tackle a really important question. How do we stop diabetes in its tracks, or at least delay it before it even has a chance to start? Let's dive right in.
So you've definitely heard of diabetes, but what if I told you there's this critical warning stage before you ever get a diagnosis, a real window of opportunity where you can actually step in and change your health's trajectory? And that warning sign, it has a name, pre-diabetes. Getting a handle on what this really means is absolutely the first step to taking back control. So, what is prediabetes exactly? Well, it means your blood sugar levels are up. They're elevated, but they haven't quite crossed that line to be diagnosed as type 2 diabetes. Think of it like a fork in the road for your health. It's serious, for sure, but it's also your golden opportunity to make a change and choose a healthier path.
Okay, so you're at that fork in the road. How do you make sure you take the right path? Well, it turns out the single most powerful tool we have is something called intensive lifestyle intervention. And we know this thanks to a landmark study, the Diabetes Prevention Program, or DPP for short.
58%. Just let that number sink in. That's how much you can slash your risk of developing type 2 diabetes over a 3-year period. And how? Not with some miracle drug, but to dedicated, structured lifestyle changes. That number alone is a total game changer.
So let's break down what these lifestyle changes actually mean. The first major goal was pretty clear. Achieve and, just as importantly, maintain at least a 7% loss of your starting body weight. The research showed that this target wasn't just doable, it was incredibly effective.
And the second piece of the puzzle? 150. That's the number of minutes of moderate intensity physical activity you should aim for each week. And listen, we're not talking about training for a marathon here. This can be as simple as a brisk walk, 5 days a week, totally achievable.
So, what does this look like in the real world? It basically boils down to a simple 3-step action plan. First, adopt a healthy eating pattern. Think whole foods, lots of fruits and veggies, and cutting back on the processed stuff. Second, get those 150 minutes of movement in every week. And third, and I love how simple this is, just sit less. Seriously, just breaking up long stretches of sitting with a little movement can make a huge difference in your blood sugar.
And get this, these changes aren't just a flash in the pan. The benefits are unbelievably long-lasting. When researchers followed up with the people from that original study, they found that even a decade later, their risk was still down by 34%. And after 21 years, still down by 24%. That's the incredible power of making a lasting change.
Now, while lifestyle change is definitely the star of the show, it's not the only player on the team. Sometimes you need a little helping hand, and that's where medication can come into the picture. Specifically, a drug called metformin.
So how do these two strategies really compare? Well, in that big DPP trial, lifestyle changes were hands down more effective overall. But, and this is a big but, that's not the whole story. Metformin still has a super important role to play, especially for certain people who are at a higher risk.
So who are we talking about here? Well, the guidelines point to a few specific groups. Think adults between 25 and 59 who have a very high BMI, women who've had gestational diabetes in the past, or people who just have higher starting blood sugar levels. For these folks, metformin can be a really useful tool. It's not a one-size-fits-all solution, but a targeted therapy. Okay, I need you to hit pause for a second. Everything we've talked about up to this point, lifestyle, metformin, that's all focused on preventing type 2 diabetes. But what about type 1? That is a completely different ballgame. It's an autoimmune disease, and it needs a whole different playbook.
So for type 1 diabetes, which, remember, is an autoimmune condition, the goal isn't quite prevention. Not yet, anyway. Instead, we're looking at a brand new frontier, one that's focused on delaying the disease after the autoimmune process has already started. And this new frontier was opened by a drug called teplizumab. It's what's known as a monoclonal antibody, which is a fancy way of saying it's a therapy designed to work with the immune system. It's for people age 8 and up who are in what's called stage 2 of type 1. That means their body has started the attack, but they don't feel sick yet. A 14-day course of this treatment was shown to delay the final symptomatic stage by about 2 years on average. That is a huge step forward.
So let's bring this all back home. Whether we're talking about preventing type 2 or delaying type 1, the end goal is exactly the same, making sure you're healthy for the long run. And the payoff here is so much bigger than just a number on a blood sugar test. When you take action, you're also lowering your risk for heart disease. The people in the lifestyle group of that big study, They gained a median of 3.5 extra years of life without diabetes. And maybe most importantly, you dramatically lower your risk of those really devastating long-term complications.
I really want to leave you with this powerful quote from the research. It basically says that getting your blood sugar back to a normal range, even just one time, was linked to a lower long-term risk of both getting diabetes and its complications. It just goes to show that every single positive step you take, no matter how small it feels, really does matter and has a lasting impact. So, what this all really means is that the road to preventing or delaying diabetes is clearer than it's ever been. It's not about being perfect, it's about making progress. The science is there, the path is laid out. The only question left is the one you have to ask yourself. What's your first step going to be?